chances of Mal sitting still long enough so I can actually look inside his mouth are next to zero.
This week's stories from Bondi Vet.
Livia's not too happy to see me today, and she is making a bit of a noise about it.
This is not normal. They've never seen a monkey around here. They said it's the first time, and this has been pretty aggressive.
It's pretty clear I'm being outsmarted by a monkey right now.
Normally people rush up here to the Hunter Valley wine country, I guess to sample a Merlot, but today it's all about a spider monkey. They've got one at the Hunter Valley Zoo and they're pretty worried about it.
Chris has driven 2 hours north of Sydney in response to an emergency call from his good mate Jason at the Hunter Valley Zoo.
Jason, how you going? Mate, thanks heaps for coming,
That's
mate.
all right,
Thanks
no
heaps for
problem
coming.
at all.
Got a problem
So
with Mal,
what,
our spider monkey, mate. We come in this morning to all his mouth swollen and a bit of blood coming out.
This is him down here.
You can see his jaw all swollen.
Yeah.
We're really concerned about Mal because he's producing a little bit of blood out of that swelling in his jaw. So it really is an emergency to get him looked at today.
As you know yourself, if you have a sore mouth, it really does affect everything in your life. It affects your mood, it affects how well you can eat, and really just simple tasks become incredibly difficult.
It is a worry if he's not eating well, but also to have a look at that's going to be a challenge.
Mal will definitely bite you, and he will scratch and he will grab a hold of you. So they're quite a powerful primate.
We're going to need to sedate him, and I mean, that's not going to be easy.
He's not going to open up and say, I don't think,
No.
is he? So,
No, he's not.
It's all in your capable hands.
Got the team together.
Yeah, put a big team together, mate. Everyone's really worried about him. You see they're quite agile.
Yeah, they are.
And they're quite worked up.
It's all hands on deck to catch Mal. The 30-year-old spider monkey has a massive lump inside his mouth. Chris needs to examine the swelling, but catching Mal is proving difficult.
A spider monkey would have to be one of the most agile creatures on the planet, so the chances of Mal sitting still long enough so I can actually look inside his mouth are next to zero.
Mal and his best mate Mike are becoming stressed by the extra attention.
We'll pull out and just let him settle, and then we'll hit him with a dart and drop him in the cage.
It's now time for Plan B.
Yes, we've got all the other guys as backup because it's such a tall cage.
Yep.
We're going to have a few guys on blankets, so when he does go out, we can be there to catch him.
Hello, yeah. No, we're coming not for you, but for you. For you. Wow. Hello, boys.
They're going to sit still for you.
They're not so game now, are they?
No, they're not.
The hard thing here is that he knows that something's up and he's not going to sit still for it.
Come on, Mal. Come on, buddy.
I think he's trying to use his mate as a shield.
He is. Yeah, we got him. Yeah. He's thrown the dart out, but you see it's empty now, so that's all gone in there. So it shouldn't be too long now. I've got the blankets ready there.
Yeah, he's starting to show a bit of signs now, isn't he?
Mal is in a precarious situation. He's about to lose consciousness. If the team can't catch him, a drop from this height could be fatal.
It's going to be all right, buddy. It's going to be all right. Good catch, guys.
For managing director Jason, it's a stressful time.
Because of his age, the whole process is complicated. Sedating him is complicated, moving him is complicated, just simply because of his age. So we are on tenterhooks today.
Yeah, he's still pretty awake there. Oh, yeah. Yeah, OK. I did want to have a little bit of a look in his mouth, but I don't think he's going to be deep enough to do that.
Mal will be moved to the zoo's vet clinic for further testing.
Just concerned about the whole move, but when it gets to the swelling in his mouth, that we really need to get him seen to and make sure that he can have a quality of life.
Hey, buddy. You're sleepy, aren't you, Mal?
Chris is about to examine Mel's severely swollen mouth.
It's all right. No. It's obviously sore. I mean, you can see even under the sedation there, he's wincing.
He's got a big swelling, a big angry, red, inflamed area. It doesn't look good. The degree to which it's swollen worries me. The only way of knowing for sure what Mal has inside of his mouth is to do two things, an X-ray and a biopsy.
X-ray.
So let's go and get a sample, so we just go straight through. The really interesting thing about Mal's history is that a few weeks ago he lost a tooth. Now my hope is that that tooth was lost because it was infected and that infection has now spread. That's the best case scenario because that just means a bit of an infection around the gum line which can be treated with antibiotics. If it's something else, if that's not the cause, then things aren't so good.
What are your thoughts, mate?
Yeah, well, I just want to get a little biopsy from inside his mouth.
Yep.
He's probably going to be a little bit too awake to do that, so we might just give him some gas. Okay, we're almost ready here. As much as I don't want to think this, and as much as I don't want to have to explain this to Jason, the one thing that would explain everything we're seeing with Mal's mouth is a tumour. Mal's old. He's at 30 years of age, which is very old for a spider monkey, and he's got a swelling that's bleeding, so it would make sense, but I really hope that is not the answer. I'd just be preparing yourself for what might be tough news.
Okay. All right, the girls are going to like that news at work.
Yeah. It's all right, love.
It's all right, old man. It's okay. It's great.
You got it.
The lump will be sent away for testing. Chris now reviews the X-rays for vital clues.
See, the worry I've got is that you look at his bone across his skull here.
Yes.
See how it's nice and clean lines. It looks like it's got some real density to it and real structure.
Yep.
Through here. You look down here and it's hard to actually see the outline of that bone.
That means infection or growth?
It can mean both.
Okay.
What he's got there is a pretty significant problem. It's a big swelling.
Yep.
It's sore and it is bothering him. So
when it comes down to it, we just want to have quality of life. So
yeah. Given the amount of love that Jason and the rest of the team have for Mal, it's going to be a tough wait, waiting for the answer of this biopsy. But in the meantime, what we can do is give Mal some antibiotics, some pain relief, make him feel more comfortable, and hopefully fight the infection that we have our fingers crossed is causing this.
Someone's very interested in who's in the box.
Going to come over and see what's doing. So where you been, mate?
It's been a huge day for Mel at the Hunter Valley Zoo. Following a series of tests on the lump inside his mouth, the much-loved spider monkey is now being reunited with his best mate, Mike.
There you come. Yeah, it's home, isn't it? Look who's here. Yeah, nothing's changed. Still the same.
And what have they done to you? Trying to break you out.
I know, you'll get your time soon enough. They're a real team, aren't they?
They're a real team, yeah. They really miss each other.
Mel's test results will be back by the end of the week. Jason is hopeful the news will be good.
We're really worried about Mal and so everyone's on tenterhooks. We really want to get a good result because he is a favourite of the park. And if we can get Mal through this, we'll be stoked.
Fingers crossed, matey. Yeah?
Well, leave me recover.
Yeah.
As for Mel, the spider monkey's results are back. And sadly, he's been diagnosed with bone cancer.
He's old and it would have been a better outcome if it was just a bit of an infection or something like that.
But Jason is hoping Mel will still have a little more time with his best mate, Mike. Today, Dr. Peter Ritchie is heading to a part of the Perth Zoo that most visitors never get to see.
I'm on my way to see a furry little critter. I've got to be very careful because she's critically endangered and she does have very sharp teeth.
Come on in, Pete.
Thank you.
Peter is meeting primate keeper Jenna and a very special little girl.
I'm here to see Livia for her health check.
Yeah.
So tell me how's she been going?
She's been going really well.
Livia is a cotton-top Tamarin. She's one of our 2 females. She's housed off display, meaning the public can't see her.
Come on.
There's a massive operation here behind the zoo that no one gets to see when they come to visit.
It's going to be a big day for the little monkey. Plans are underway for her and her sister to eventually be moved to a public display area. The first step is a full health check under general anaesthetic for lively 7-year-old Livia.
The procedure today is to ensure that Livia is in good health and is able to go into her new exhibit. We want to make sure that she's able to get around and do all her normal primate things while she's in there.
Yeah, to check she's all good for their big move.
All right, Jenna, I'll leave you to it to get them ready to transport up to the hospital.
Sounds good.
We really want to get her move on now. She is a tiny little animal and it's important we get the whole procedure done rather quickly. So I want to get things happening so we can get her back into her exhibit as soon as we can. We've got little Livia in here.
At the Perth Zoo, Peter is ready for his special patient, 7-year-old cotton-top Tamarin monkey, Livia.
The procedure today is a general health check to ensure that Livia is in good health and is able to go into her new exhibit.
Livia has been housed in a behind-the-scenes section of the zoo. If this health check goes well, she'll be ready to make her public debut.
We want to make sure that she's able to get around and do all her normal primate things, and it's a really good opportunity while we're moving her to have her in our hands and have a closer look at her.
The team is wary of Livia's razor-sharp teeth, so she's being held in a bag for everyone's protection.
Just going to pop her head into the mask through the bag.
Peter's first step is to sedate the tiny primate.
Livia's not too happy to see me today, and she is making a bit of a noise about it. Yeah, she is just lightening down a little bit now. I can feel she's relaxing.
So just loosen that bag up so we can see what her response is like.
But she's not really reacting now, so let's see what she's doing in there. All right, here she is. All right, back under the mask. She's having nice breaths at the moment, which is good. I can feel that she's got a nice, strong heartbeat. She's relaxed down quite nicely at the moment. Give her a few more moments to breathe in the anaesthetic and make sure she's at a nice level of anaesthesia, and then we'll get ready to do our procedures. Because these guys are such a tiny little critter and they have such a fast metabolism, they hold a very high risk under anaesthetic. They tend to lose their temperature quite quickly and their glucose levels will drop very quickly, so it's important we get this done rather fast.
Cotton-top Tamarin monkeys are highly endangered, so it's crucial Livia is examined thoroughly to ensure she remains healthy.
What I'm going to do now is have a look at her from head to tail. It's rare that we get the opportunity to get so close to our animals and ensure that everything is in good working order, and so I want to make sure I don't miss anything. I'm going to start by just having a look at her eyes. So I'm trying to have a little bit of a look into the back of her eye. It is a bit difficult because she is so small. So there's a little bit of an opacity in one of her lenses. It may just be the first signs of her starting to get cataracts forming in her eyes. And that's a normal age-related thing for many different animals, but at the moment it shouldn't be too bad. Just like us, dental disease is common and sometimes they get some bad gingivitis, but her teeth aren't looking too bad. A little while ago she fractured the very end of this tooth here and healed very, very nicely. Doesn't seem to be any issues. And then we'll continue our physical exam. I'm just going to continue down and keep looking at everything on this side. Little toenails all look fine and her palms all look fine. Arthritis can be a bit of an issue as they get older as well. They rely so much on their arms and their legs to get through the trees and manoeuvre through the enclosure. So it's important that they're able to do that. Everything's feeling quite good.
Pete, we're just at half an hour of anaesthetic time, so we probably just need to step up the pace a bit because we need to get her awake.
No worries, let's get moving. The clock is ticking, and we know from previous procedures that we don't want to keep going too much longer than this. All right, shall we flip her over and have a little palpate of the abdomen while she's there quickly?
At the Perth Zoo, Peter is performing a full health check on tiny cotton-top Tamarin monkey, Livia.
We're running out of time and we really need to get moving. Feels okay.
All good?
Yep.
Over.
My next job is to collect a blood sample from Livia. The vein that I'm aiming for is extremely tiny and I can barely see it, so I'm relying on feel to know where it is. So I'm feeling for the pulse of her artery. I know that the vein lives next door to that artery, so I'm aiming for the vein. I can feel the pulse at the moment, and knowing my landmarks, the vein should be next door to it. Hopefully I'll get it in.
If she gets the all clear, the plan is to eventually move Livia and her sister into a public display area.
The next step is probably the most gruesome.
Peter now needs to check for the potentially fatal disease tuberculosis.
We're going to give her a tiny injection of tuberculin into each eyelid. That's to see if she is carrying the organism. It is something that primates can have, including us, and can carry without us knowing, and we can see signs of ill health later on, and it's something that we want on the screen for her protection and her safety as well as ours. Injecting it now into her eyelid. What we're going to be looking for here is if she reacts to this. If she has the organism and her body has an immune response to it, her eyelids will swell over the next couple of days, and that will be our answer. Her right eyelid. You can see the eyelid swell as I'm injecting it, but that's not the swelling that we're going to be looking for. That'll go down very quickly. It's gone well. She's looking healthy and fit, and it's time to get her back in her enclosure. Now we're conscious of time. The longer she's under, the more risk we have, so we want to wake her up. We're just going to position her inside the pet pack as she recovers.
So if she wakes up quickly.
I need to make sure I'm able to get her tube out when we're ready. So as she's waking up, we're just giving her a bit more oxygen. Because she is so tiny and has such a fast metabolic rate, it's important that she eats very quickly after this procedure as well. So once she's awake, what I'm going to be wanting her to do very soon after is to eat something that has a bit of sugar in it so her glucose goes back to normal. I know. There we go. There we go.
Now that Livia is waking up from the anaesthetic, Peter will have to wait for the results of the blood tests and hope that there's nothing abnormal.
We've got to move on with the process now. We want to get her back into her exhibit as soon as we can.
At Perth Zoo, it's the day after Tamarin monkey Livia's full health check. Peter has come to see his little patient and keeper Jenna.
So how's Livia going today?
Really, really good. Livia looks bright and alert. She came back straight away for some food and straight back into her conditioning cage.
You can definitely tell when she's happy, when she's a bit inquisitive. So it's all looking like it's really good news. Her blood tests, we've got the results back and she's all normal. Having a look at her today, I'm not seeing any reaction with her eyelids, so I don't think she's got tuberculosis. She's recovered well and looking happy, and she's in tip-top health.
Livia will soon go on public display, but for now she'll stay in a private part of the zoo with her sister.
She's housed off display where we're breeding many different animals and housing many different animals, and part of the zoo that no one normally gets to see, and somewhere that we're contributing massively to saving wildlife.
Chris, I got a call. Just a monkey has actually entered the school and is trying to attack or scaring the children. Yeah. So we gotta go. We gotta probably move that monkey out of that school.
Yeah, sure, sure, no worries.
Edwin and his team are on call around the clock to help rescue animals in trouble.
Okay, we're all set. It's done. Gun ready, medical supplies ready.
Do we know the condition of the monkey now?
He's probably hungry. It's dry season. He's also lonely. He wants to find a group, and yeah, somehow he got lost, I think.
Yeah.
Okay, here it is. That's the school.
Yeah.
The kindergarten and the temple. We'll park the cars down here. Okay.
So do we know where it is in here?
They said it's somewhere behind here. This is not normal. They've never seen a monkey around here. They said it's the first time, and this has been pretty aggressive. Next to the school and the little kindergarten over here, it can do some real damage. Eventually, he's going to come down again, but I'd like to get him down our way.
The locals are saying they've seen it on the roof, but just look in the roof now, there's no sign. So Edwin's just trying to work out where it could be, but it's so fast and so elusive that...
He seems to be on the other side, near the temple. He's on the roof.
The worry is if we can't catch him today, then some of the locals may have a go themselves. And that may not be kind, it may not be as gentle as we're hoping this is going to be. I've seen through here. So just
where one of the roofs comes down at an angle. He's just perched in there and he's found a little ledge and a little, almost looks like a window he's poking his head through. So is he inside the temple there? Actually inside the window?
Yes.
If he goes in around the temple, are there any rules around?
No, we just have to take our shoes off, that's all.
But we can still shoot him in?
We can still shoot him in the temple, as long as you do it with your shoes off. Let's go.
You see him? It looks like he's around the corner there.
He's a big boy?
Yeah.
Got him. He's very elusive, he's very quick. There's buildings, there's rooftops, there's branches. I have only a split second to point the gun and to actually pull the trigger.
You might think that maybe it's time for me to have a shot. Edwin is a former Special Forces soldier. This is a time where I'm quite happy to stand back and let him take it.
Well, I still have to get the right shot, though. The first one, I hit him in the hip, which was good, but it got out very quickly. You need about 3, 4, 5 seconds for all the anesthesia to go. You can see he's a bit wobbly, but not wobbly enough to catch him yet. The second shot I missed. He feels pretty safe up there, and we can hardly get up there. I can't walk on that roof. The roof tiles are just too thin.
Edwin needs a change of tactics, so locals bring in a crane.
Dog, young one, don't get.
So he's climbed onto this roof now, which is, it's actually a crematorium. He's hiding just in this ledge behind this big brick chimney here.
Godverdomme! Hou ik dog nu? Houd die kop maar lui! Die kop!
He's off again.
Hou ik dog nu? I just can't get the shot. Sorry, you know. ฮะ? มันขยับตัวไม่ได้อะมันมีคนมานั่งอยู่ด้วยมันไม่ไหว
This monkey's amazing. I mean, you know they're intelligent, you know they're agile, you know they're fast, and he's just proving to be every single one of those things.
Huh? On the other side again? It's too high on that roof. I don't have a shot.
With so many children around, locals want to see the monkey caught and removed as soon as possible.
You think he's going to stay on the roofs?
Yeah, so many people around and I can't control the people around us. That's the problem. I got 20 people walking around. They're all running, shouting, laughing. Not ideal. I think I'm more stressed than the monkey is.
Suddenly, the monkey makes a break for it. Now Edwin can get a clear shot.
Got him. Wow.
Good shot, mate. That was a very good shot.
Okay, Ling, the monkey is down from the injection, so I just gotta get the youngest, the smallest guys to come.
Even though he's now gone to sleep, the problem is that he's now asleep on the roof. The roof tiles are too fragile for anyone like me or Edwin to go out there and actually go and pick him up. So I'm now trying to work out a way to get this monkey off the roof.
There you go.
There he is.
Come on, boy.
In this situation, Edwin could have very easily just given up quite early, but it's in these times where you realise that he does this for the love of it. He's really persistent, really committed to making sure this monkey and all the other animals get the best possible home they can.
Look at these teeth. They can do some real damage to a child.
His heart rate's incredibly high, so it's a measure of, I guess, the stress that he's gone through over the last little while, but also the fact that he's not completely under anaesthetic.
He's really getting stronger and stronger. If you get the other arm to the back.
The monkey needs to be taken back to the rescue centre for observation before it can be released.
I think people think it's really interesting to see the monkey finally being caught. They want the monkey out of here, but they also want the monkey out in a nice way. That's why you saw that even the local municipality brought that crane. People want to get it done properly. People want to go home and say, well, end of the story is a good story. And yeah, That makes me happy, actually, to see that. That means we're not just only us, a bunch of crazy animal lovers, you know, that want to do something good, but we actually feel, when we're talking to the kids and the adults around here, the teachers, that they all feel that this is important, that it's done properly. So it makes you feel good.
Kapong kap. Bye-bye. Bye-bye.
Oh, this is a good spot.
Yeah.
Chris and Edwin are about to release a wild monkey.
There we are.
It's a bit calmer than the schoolyard.
You see how wild he gets?
Yeah.
I think he realizes that he's somewhere he should be.
So there'll be a few monkeys around here, but not too many.
Yeah, he might have some old friends here, or some old enemies, we don't know.
He can smell the mountain, he can smell his natural habitat. He just wants to get out there.
Go this way.
Yep. So just looking for a shady spot close to that, that hill there.
I'm actually quite worried he's going to go after us. So I think it's better to actually put the cage on the side, unlock it, walk a few meters back, and let it go.
Okay, let's do this.
Here are the monkeys. We've got to hurry.
All right. Okay, let's do this.
There he goes. That was easy.
After all the build-up, it was a bit of a disappointment, really. Just opened the cage door and he just decided this case is closed. He was gone. It's part of the welcoming committee here, is it?
Yeah.
In the last week, owners of the Mansfield Zoo, Bronwyn and Dave, have become increasingly concerned about Ziggy.
He's got some little lumps on his eyes. They've been there for quite a long time, but just recently they've got really large, and it's just got to the point where we need to get them looked at because they're going to start impacting on his vision and possibly on his eyes as well.
The really frustrating thing for me is that I can't go in there with him. Monkeys carry a lot of diseases that are transmissible to humans, so if I get in there and he bites me or scratches me, then I could leave Mansfield with herpes.
Zig, come on.
So the whole idea here is to make Zig a little bit jealous of the food going on here, so he's going to come down a bit closer for us.
Hopefully, yes.
He's looking down to almost taste it. I think he really wants it.
Ziggy's favourite foods are only managing to get the attention of his neighbours.
It's pretty clear I'm being outsmarted by a monkey right now.
It's time for Plan B. The eggs and almonds are now placed in the capture cage.
Come on, mate.
Hopefully Ziggy will come down and take the bait.
He went halfway in and then ran out.
Oh. Serious?
He's in. Yeah. Now we can actually get a really good look at Ziggy's face. It's amazing how big those lumps are. My initial thought was that maybe they're cysts that have grown out from his skin there, but they could also be papilloma, so warts, or it could be a type of tumour. It's hard to know right now without actually getting in there and taking them off and getting the samples analysed.
Back at the clinic, Andrew's waiting for news on Ziggy's capture.
How'd you go, mate?
It was pretty simple.
Yeah, good. I was wondering who's going to win the battle.
It's very one-sided. I'll tell you the true story later on.
Okay, then.
The hard part about operating on Ziggy is the fact he has so many of these lumps, and they're also in a very sensitive area. If these were to get any bigger, or if there were to be any more of them, the surgery would be nearly impossible. This is about the last possible moment we can do it, and do it safely.
Chris is using a probe with an electric current running through it to burn off the lumps. The electrocauterisation helps minimise any bleeding.
Now we're up close to it, you can see definitely. There's some quite serious irritation. There's extra pigmentation and extra coloration around the eye. There it is there. The really interesting thing I'm noticing when I'm taking these lumps off is the fact they're not really that deeply invading into Ziggy's eyelid. Normally tumours will quite aggressively push their way into the body, whereas warts and cysts generally don't. I think that's a good sign. We've taken off 4 already and you can already see a pretty dramatic difference. The tricky thing now is how much more do you do? You take off too many, you're going to cause a lot of irritation, a lot of inflammation. It may not be necessary. I think Ziggy's going to have to live with a few little lumps and he'll get by with that. I think as long as they're not starting to rub in his eye or block his vision, he's going to be okay.
Zig, you actually look a lot better, don't you?
It's actually pretty awesome to see a monkey this close and do something to help him as well. It's a pretty cool experience.
Ziggy's biopsies will be sent to the lab to be tested. For now, the monkey will be kept at the clinic for observation as he tries to shake off that surgical hangover.
You know that feeling you sometimes get when you wake up in a hotel room, you don't really know where you are? Ziggy's going to get that times by about 100. It's going to be really confusing and quite confronting for him to all of a sudden look around here and have no idea where he is.
Talking of Ziggy, it's good news. The monkey is back home and his tests are all clear.
Really pleased. And the fact that his eyes are much bigger and brighter. It's a bit of plastic surgery, works marvels.
Okay, so just before you go, I've just got somebody I'd really like you to meet. A little de Brazza's monkey who's diabetic that we've been managing very closely for the last few months. Good girl. So that's her insulin there, and I have to give it to her every day, so it would be fantastic today if you would like to give it to her, so I'm not the big meanie.
You've got to remember that monkeys are just like little people. I feel like I'm being set up here. And like us, they have their good days and they have their bad days. And being a de Brazza's monkey, Kamani is also known to be a bit of a biter. So when I bring out this insulin injection, it could become a very bad day for both of us. There we go.
Very good.
Not too sure about me now, are you? The secret to treating Kamani is food bribery. Works every time. How much can you handle?
She likes sweet potato.
You take that as well? Yep. About that? Yep. Cool.
With this species, we wouldn't normally be able to go in with them, but she's a very special individual. She even quite enjoys a bit of a pat as long as she's got some food in her mouth.
What? You always go looking for something better. You'll never be happy in your life if you always think there's something better. You like that?
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.